All right, Dr. Emer, we're live.
Hey guys, it's Dr. Emer, and I'm really excited because my client is going to get some amazing results. She has a lot of those porous scars you guys could see on the cheek area. We already did some TCA, and now we're doing the laser. Obviously, lasers hurt, so we're doing our best for pain management, nerve blocks, and topicals. And we're going nice and slow with the halo, taking our time. This has the deep laser and the superficial laser firing in one, the only device in the US that does this. In my hands, getting amazing outcomes for acne scars. The porous scars are always the most difficult because some of the pores are just genetic and you're never going to get rid of them completely. They just have to be lasered over time. Some of them are deeper icepick scars that we did with TCA Cross, and those will improve again over time. But today we're going to do a really strong laser in the center part of her cheeks where she has all those scars called CO2.
So
That's going to be our next part. What did you say?
They want to know your percentage on CO2.
I don't know what that means, percentage on CO2. Not sure what that means, guys. You got to ask more detailed questions. You guys can see I'm focusing a lot on these porous areas.
Someone said I did this yesterday. It was so comfortable. Can't wait to see my results. The team is the best. So professional, polite, and sweet.
Aww.
Amazing energy.
Thank you, guys. I'm super excited, actually. Make sure you send all your pictures in because we really want to see how you're healing and tell other people about it. I think a lot of it has to do with how excited you are about treatment. If you're more mentally prepared, you do better. And following the post-care and the pre-care is really important. Skincare after these treatments, especially if you have ethnic skin tone or mixed ethnicities, it's really important. The lighter skin you are, the less risk of hyperpigmentation, but there's always a risk. So almost done on this side. You guys can see we're going really slow.
Someone said, does Halo have disposables?
Yeah.
Yes, it does, guys.
EmerCosmetics.com. You guys can get virtual consultations for our skincare protocols. She's going to use our foaming polish. She's going to use our Refit Base Peptide, anti-age serum for healing. Hyaluronic acid is really important. And my botanical serum, which you guys know I've been talking about. This is the last pass, which has hyaluronic acid, vitamin C, aloe, melatonin, caffeine, green tea, thyme, and cucumber extracts, all for healing.
What is her recovery time?
It's going to be about 3 to 5 days, a little bit longer for the CO2 areas. This is the final pass. And then from there, she may be light pink for maybe another 5 to 7 days, and then we're going to see healing. CO2 takes about 3 months to fully see the end result. And so it's going to be a little bit of time before we see the final outcome of the CO2.
Do we use numbing cream? Yes, we do.
All the way to the right. We're almost
We
done.
use our topical numbing.
Last part.
Can you combine Halo with Aerolase?
Take a look at the dead skin cells, you guys. Those are all the dead scars that are coming up. And yes, you can combine any of the lasers with Aerolase. Remember, I told you guys, turn all the way right. Perfect. Aerolase is the laser that everyone should have in their practice. If they have acne, you guys can see, I'll show you really quickly. Here's all the TCA spots that we did. You can see all the TCA. Those are healing. Those are going to heal perfectly. They're going to have little scabs there. This is the final large area. Doing awesome. The TCA parts will have little scabs there, so it's really important to do my trifecta of silicone gel, which is our Silogen, our peptide serum, which is my Refit Eye, and then also stem cell anti-age. That helps it so that it heals the best. If you don't do that, it's not as good healing. You don't want to use Aquaphor, Vaseline, triple antibiotic ointment, anything occlusive like that. We don't do that anymore. It doesn't give the same results. We're getting her through it.
Someone said, let us see the whole procedure and don't stop in between the steps.
Well, we always stop, you guys.
We can't show you everything.
I give you tips and tricks on my subscriber, Jason Emer Official. So I'm going to go through some more detail on that after this case on there. So definitely check that out.
Can you do this treatment on neck and chest? Yes, you can.
Did it yesterday multiple times, twice. You guys see, we're really stretching the skin here. Going all the way so we get every spot. We don't want to miss any spot of her face. And we want to go a little more density, about halfway there. A little more density on her cheek central area where she has a lot more of those pores and scars. Doing really great. Some people get a little shaky from the nerve blocks, so I always tell people that will go away in an hour or two. She's doing really, really good. We're almost done. Remember, the pre and post care is super important, so please, when you guys are prepping, if you're not doing this with me, contact our team and get our skincare protocols. I have a whole non-ablative package at emeragecosmetics.com designed for people that can't come to see me, that want this treatment done elsewhere, but want to heal with the updated, innovative, progressive package and aftercare. Definitely makes the results even better. And in about a week or two, you start my Aerify with my derma rolling system. I made it on purpose. A couple more passes to go.
Have you ever done halo with no numbing?
No, it's very painful. You can't do that.
You don't recommend that.
I would never do that. Even with numbing, it hurts. She's doing great though. We're almost done.
What you use to apply TCA Cross so precise in the ice picks? Gotta
use toothpicks, guys. I don't like syringes there, and I definitely would never use a Q-tip. All right, 2 more to go. We're almost done. This is the final part. You guys can see with the halo, all those little dots will peel. They'll become little scabs over the next 3 days. Deeper scabs with the TCA, and even more deep scabs with the CO2. Alright, so this is it for Halo, you guys. We will be back for a second last part, which will be our deep CO2 laser, our core.